Hey everyone, welcome to my YouTube channel Tooth Vlog. Today we will talk about sequelae of malocclusion. Correct tooth position is an important factor for aesthetics, function, and for overall preservation or restoration of dental health. While most malocclusion may not adversely affect the health of an individual, nevertheless are capable of producing undesirable function and aesthetic imbalances. First, we will enumerate the sequelae of malocclusion, then we will talk about them one by one. So, starting our topic, the first sequelae of malocclusion is poor facial appearance. The second sequelae is risk of caries. Third sequelae is predisposition to periodontal diseases. Fourth sequelae is psychological disturbances. Sixth sequelae is risk of trauma. Sixth sequelae is abnormalities of function. And seventh sequelae is TMJ dysfunction. Now we will talk about them all of these sequelae one by one. First is poor facial appearance. Malocclusion is capable of adversely affecting the facial appearance of an individual. Here you can see in the diagram, she is a class 3 patient. As you can see, mandible is prognatic and maxilla is retrognatic, and this problem leads to poor facial appearance. As you can see there, the patient has poor facial appearance as compared to after treatment results. You can see the patient has quite good facial appearance. So we can say that malocclusion can cause poor facial appearance, and this is one of the indications for the orthodontic treatment when the facial appearance is affected by malocclusion. So it is indication that the patient needs orthodontic treatment. The second sequelae of malocclusion is risk of caries. Malalignment of teeth make oral hygiene maintenance a difficult task, thereby increasing the risk of caries. It may also reduce the potential for natural tooth cleaning, thereby increasing the risk of decay. Third sequelae of malocclusion is predisposition to periodontal diseases. Malocclusion associated with poor oral hygiene is a frequent cause of periodontal diseases. As you can see there is two problems, malocclusion and poor oral hygiene, and that has led to the serious periodontal diseases. In addition, when teeth are placed in abnormal position, as you can see in there, they are procline and these are also procline, and there is an abnormal position for these teeth, and it can cause a traumatic occlusion with resultant periodontal tissue damage. Here you can see the damage of periodontal tissue, that is because of malocclusion and plus bad oral hygiene or not good enough oral hygiene that can lead to trauma to periodontal diseases. Not only this kind of malocclusion causes periodontal disease, there is another malocclusion that can seriously cause periodontal disease, that is sphere crowding. And also there is traumatic overbites that can lead to the increased loss of periodontal support, and therefore are another indication for an orthodontic treatment. The next sequelae of malocclusion is psychological disturbances. Malocclusion that adversely affects the appearance of person lead to a psychological disturbance, because unsightly appearance of teeth make a person highly self-conscious and turns him into introvert. Thus, treatment of malocclusion in such patients helps in improving the mental well-being and also increases the confidence. Fifth sequelae of malocclusion is risk of trauma. Teeth that are severely proclined and are at high risk of injury, especially during play, uh, and also the teeth when class 3 malocclusion, when the teeth and lower mandibular teeth are forwardly placed, the maxillary teeth are backwardly placed. This can also cause trauma to both upper and lower teeth. The next sequelae of malocclusion is abnormalities of function. Many malocclusion cause abnormality in the function of stomatognathing system, such as improper deglutition defects and speech and improper respiration, and most importantly inefficient chewing or less efficient chewing as compared to when teeth are properly aligned. As you can see in diagram, the malocclusion has led to very severe periodontal loss, but also it is difficult for a patient to chew food in this condition because the teeth are very susceptible to break, and they also have less periodontal spores, so they may be mobile or they may become mobile at some time, but this leads to abnormalities in function, and this is due to malocclusion. So we can say that this is the sixth Sequele of malocclusion, that was abnormalities of function. Seventh Sequele of malocclusion is TMJ disorder. Malocclusion associated with occlusal prematurities and deep bites are believed to cause a TMJ problem such as pain and dysfunction. So TMJ disorders are mainly because of two types of malocclusion. The first one is occlusal prematurities and the second one is deep bite, because in both cases, in cases of first one is occlusal prematurities and the second, let me write it down, where is, okay, occlusal prematurities and the deep bite. They increases the forces on the tooth and function of tooth that leads to increased power uh, or increased force at the temporomandibular joint area, and this leads to temporomandibular joint problems, mainly pain and dysfunction. Thank you for watching our video. Don't forget to like, share, subscribe and comment.